Me now from Wasatch Pain Solutions. It's located in South Jordan, and he and I were just talking about those aches and pains that everybody gets, whether you're aging, whether you're active or not. Sometimes you just can't stop that nagging shoulder pain or knee pain, and that's what you do at Wasatch Pain Solutions. You treat those.
Correct. So we're trying to address the degenerative joint conditions for the most part, and also orthopedic injuries. Both in multiple joint areas, but specifically the shoulder is what we're going to be talking today.
So Dr. Khan, when you say shoulder pain, what are you talking about?
We're talking about rotator cuff tear pain. We're talking about raising your arm up, trying to grab something, or putting the Christmas lights on. Things like that that normally are your normal activities are becoming more difficult.
Maybe even skiing, or you're sledding out there with all that new snow and you're like, wait a second, it doesn't feel right. How do you know when you need to come in?
Well, when something like that happens, traditionally, these things will improve after about 3 to 4 weeks. But if they're not consistently getting better, or you're not seeing some gains as far as strength returning, then it's worth probably seeing your doctor.
So what sort of treatments do you recommend for something like that?
So for that, traditionally, the original treatment was cortisone or steroid type of injections to limit or reduce the inflammation of those areas. But what we found is those steroid injections actually do more harm than they do good in the long run, because they inhibit the healing of those tendons or ligaments.
Really? And that was the go-to before?
Correct.
So what is it switched over to? What do you recommend?
So now we're moving into a new innovative type of treatment called Regenexx stem cell therapy and blood platelet therapy. So what we're doing is taking your own blood, taking your own stem cells from your bone marrow, and using it to try to heal the damaged tissue in that area.
Where do you take the stem cells from? You said your own bone marrow.
From your bone marrow, right on your hip area.
On your hip area. And then that's re-injected into that area. We're talking about the rotator cuff. So you would inject it back in?
Correct. So there's different locations that we want to inject it in depending on what the MRI is, as well as the patient examination shows. But traditionally it's rotator cuff tendons, it's joints, it's labrum tissue, it's also different small little joints that are around the shoulder as well.
And what are the benefits? What happens once that is injected, that stem cell, into the shoulder?
So it does many things, which is kind of the cool part of it. Part of it is it encourages other cells to actually help repair, but it also does the repair itself. So it can become the cell type if it's attached to that area of the damaged tissue.
Is it painful?
Again, as far as the bone marrow aspiration or the stem cell therapy?
Either one. I mean, I know when you think about having a treatment done, that's maybe one of the questions that you get.
Sure. Traditionally, not too bad. It is a series of injections, so be expecting to have some irritation just with the numbing of the area. But traditionally, once it's numb, it's not too bad at all. And including the bone marrow aspiration, really honestly, most people choose not to get any IV sedation to deal with that.
But the bottom line, Dr. Khan, and everybody out there, is this isn't surgery.
Correct.
Right? This is different. The recovery is a lot more
easier.
Easy?
It's less painful.
Okay.
Oftentimes after surgery for the shoulder, you can be in rehab for about 6 months or so before you're kind of back. We're within 3 months back to kind of doing normal activities and doing all kinds of things, and by 6 months you're doing most anything you'd like to be doing.
So you've seen, personally, incredible results.
I have. So what's interesting is the current model of surgery at this time makes us feel like most patients are going to re-tear their shoulder area about 50% of the time within the first 2 years. And that happened to my mother-in-law. So she actually had this happen to her, and she had rotator cuff surgery repair done. 3 months after her surgery, she ended up just misstepping on her staircase, grabbed the stairwell, and pulled her shoulder a little bit. She felt a little pain, but it was nothing bad at the time. Afterwards, she ended up seeing the surgeon because it wasn't going away. He ordered a new MRI, and it showed that she retore the surgery that she had just completed 3 months ago.
After going through all of that. The bottom line, I think, that you're saying is no one has to live with pain.
Correct.
There is a solution out there. Wasatch Pain Solutions, again, located in South Jordan. All the information and business hours and phone number right there on your screen. We'll make it easy. Go to our website, goodforutah.com/GTU, and we'll put all the information right there. Dr. Khan, thank you so much.
No problem.
For being here today. All right.